I would like to invite the committee to resume its consideration of agenda item 132, entitled Program Budget for the Biennium 2014 and 15, Revised Estimates UNMEER. And in this connection, it is with great pleasure that I welcome to the Fifth Committee the Chef de Cabinet, Ms. Susana Malcorra, and invite her to introduce the report of the Secretary General on the revised estimates for the Biennium 14-15, relating to General Assembly Resolution 69/1 for the Office of the Special Envoy on Ebola and the United Nations Missions for Ebola Emergency Response, contained in document A/69/590 and Corrigendum 1. Ms. Malcorra, welcome once again. Good afternoon, and you have the floor.
Thank you, Mr. Chairman, and members of the committee. It's a pleasure to be here with you and to introduce this agenda item. I have the honor to introduce the report of the Secretary General on the revised estimates from the program budget for the biennium 2014-15 in relation to the Office of the Special Envoy on Ebola and the United Missions for Ebola Emergency Response, UNMEER, under agenda item 132, contained in documents A/69/590. The outbreak of Ebola in West Africa tested the global community's response capacity. Characterized by the elusive nature of the virus, and unlike other emergencies response scenarios, the United Nations was called upon to provide response not in the aftermath of a disaster, but during an ongoing and escalating crisis, one that unfolds across national boundaries. It represents an unprecedented challenge that calls for a unique strategy and a unified UN system response. In this context, it is important to recall that the manifest urgency that arose to support the work of the World Health Organization was at the center. Designed to provide advice and technical support, the sheer magnitude of the operational requirements and field deployment needs far surpass WHO's capabilities. In response, the Secretary General established the UN Mission for Ebola Emergency Response, UNMEER, the first UN mission for a public health emergency, in September. The mission was established following the adoption of by the General Assembly of Resolution 69/1 and based on the identical letters of the Secretary General dated September 17, 2014, addressed simultaneously to the President of the General Assembly and the President of the Security Council. The United Nations response is framed by existing national and international plans and strategies with a focus on supporting the governments of the affected countries. As the representative of the United Nations system, the Special Envoy of the Secretary General on Ebola provides overarching strategic leadership, coordination, and guidance to achieve those objectives, including through consultations with member states and other stakeholders participating in or contributing to the international response efforts. In the field, UNMEER builds and maintains a regional operational platform to ensure the rapid delivery of international assistance to meet the needs identified in the affected states. Operational implementation of the strategic response framework is primarily carried out by the United Nations agencies, funds and programs, and other implemented partners. Through these means, the UN system response is optimized to better meet this unique challenge. The overarching and singular objective of the United Nations system, including the Office of the Special Envoy, UNMEER, the UN agencies, funds and programs involved in their response, is to halt the spread of the Ebola virus. The mandate of the mission is linked to the successful implementation of the international response to the Ebola virus and its impact. UNMEER will cease to operate once the Ebola outbreak within the affected countries is contained, and when national governments of those countries feel sufficiently able to transition into normal Ebola transmission prevention and response approach. To date, much has been achieved. A strategy is in place, the operational framework for scaling up UN system approach that has galvanized support to affected communities. UNMEER is on the ground working closely with the governments of Guinea, Liberia, and Sierra Leone, and Mali, UN agencies, funds and programs, and implementing partners to ensure that the key components of the national strategies to end the Ebola outbreak are enabled. In this relatively short period, significant progress has been made in slowing the spread of the disease as communities become empowered and engaged. Nonetheless, the challenge is great and much more work remains to be done before the crisis is declared under control. There is no room for complacency. To best respond to the challenges of the Ebola crisis across the three countries, UNMEER will be configured in a manner where the structure is closely aligned with the four critical lines of action: case finding, contact tracing and laboratory surveillance, case management, community engagement, and social mobilization and safe and dignified burials. While taking into account the need for tailored responses at the national level to address each specific operational context within the affected states, similar structures will also be used to address these functions at the national level under the leadership of the Ebola crisis managers. The resource requirements for the period from September 19, 2014 to the end of 2015 amounts to $199.6 million net of staff assessment and will cover, first, a total of 376 positions in the Office of the Special Envoy and UNMEER, second, 20 positions in 2014 and 9 positions in 2015 at headquarters to provide backstopping in the areas of legal support, medical service, finance and budget, procurement and security coordination, as well as, third, operational costs in support of the mission. Mr. Chairman, distinguished members, due to the nature of the Ebola crisis, including ongoing evolutions of the disease profile and transmission trends, UNMEER will have to rapidly and proactively adjust the mission's operational posture and footprint to best respond to the changing conditions of needs. Through a unified organizational approach, the mission will be flexible and agile so as to be able to adjust its field presence and operational models to best address the requirements on the ground. Allow me to take a moment to take stock of where we are. As we meet today, only 2.5 months after we first came to you to support the initial standing of UNMEER, there is much to report. Following its original deployment on September 29, in the span of only 2.5 months, considerable progress has been achieved. UNMEER is operational on the ground to directly support and coordinate the work of the UN system on Ebola response. Responding to the evolving nature of the outbreak, the mission is increasing its support to operations at the district level as the virus becomes less pronounced in some urban areas like Monrovia, but more geographically dispersed in the country at large. In response, the UN system is building up its cross-country surveillance and monitoring capacities, as well as rapid response mechanism, to better respond with surge support to flare-ups of the virus, like the current situation in the west of Sierra Leone, where transmission has intensified. In Guinea, where we have seen improvements, transmissions continue to increase in the Guinea Forestière area, where additional efforts are now being targeted. We have also translated lessons learned into early action to immediately open a small UNMEER presence in Mali at the request of the Malian government to support the stopping of the outbreak in Bamako before it escalates into a crisis to the equivalent to the one in their neighbors. Today, there are no more cases reported in Mali and no more contacts in quarantine. In a month's time, if Mali continues to report no cases, it will be declared Ebola-free, and we will close our presence as part of the mission. The improvements that we are seeing are testament that our four-pronged strategy of isolation, treatment, safe burials, and social mobilization is working where it is fully implemented. More people are gaining access to treatment, more contacts are being traced, burials are becoming safer, communities are mobilizing to protect themselves. The Secretary General has deployed to West Africa to personally engage with heads of state and government, the member state implementing partners, regional organizations, NGOs, and to further galvanize the UN system response through UNMEER to counter the Ebola spread. He will lend his high-profile advocacy to combating this scourge. His message is clear. Now is not the time to ease our efforts, but rather to redouble them to bring the crisis to a definite end. We have witnessed how just one case can trigger an epidemic. The overall number of cases is still high. We have much more work to do. We need more robust contact tracing. We need greater preparedness at the district level. The mobilization of the international community behind the affected countries and the support to the startup of UNMEER has been tremendous. Thank you, Mr. Chairman.
I thank Ms. Malcorra for her statement.